As officials across Canada work to vaccinate as many people as they can against COVID-19, there are new reminders that the virus is moving quickly too.
There is a race here. There's a race between us getting this out of circulation and it evolving in order to avoid the things that we're trying to do to limit its growth.
Canada has detected its first case of the South African variant of COVID-19. At least 14 cases of the UK variant have been found here as well. They're no more deadly, and the vaccine will likely still offer good protection, but both variants spread more easily in the community, and that is a major cause for concern.
If you have a more transmissible virus, even if it doesn't in and of itself cause more severe disease, if you have more people infected with the virus, that's just a greater proportion of people infected, which means a greater number of hospitalizations and sadly a greater number of deaths.
What public health officials don't want are these variants to begin circulating widely. A virus that behaves differently may not be as easily controlled with current mask policies or capacity limits, and additional measures may be required to keep infection levels at bay.
It's entirely plausible that a dominant contagious strain would mean that we couldn't have schools open. That's possible. My biggest concern, though, is shared air, honestly, that even with masks on, shared air may become a little bit less safe.
It's why the federal government has taken new steps to keep these variants from arriving in the country, requiring travelers now present a negative COVID test before boarding an incoming flight.
We have to make sure that these variants that might spread more easily do not start rapid outbreaks in the community and infecting large numbers of people.
Alberta's chief medical health officer says there is no evidence the province's first case of the South African variant has spread in the community. Yourex-West, Global News, Calgary.